everyone. Today I'll be talking about a topic that I get asked a lot, and also I see a lot questions about this in posts in Facebook and social media. Is the question is like, is the Australian job market saturated for doctors? Have doctors Can doctors, get jobs in Australia with AMC one? So the answer is yes and no. So the answer is not really clear. Um, Definitely the job market is much better than the UK. Like I know a lot of doctors who got jobs in with AMC one in Australia, some of them offshore, some of them onshore. And I know a lot of doctors who did not get job with AMC one, some of them offshore and some of them onshore. So it doesn't seem to be very clear. So the most important thing is to have a very simple and well-written CV and cover letter. If you have 10 years of experience and you have a terrible CV and cover letter, you will never get selected, no matter how many years of experience you have. So write well your CV and cover letter. I have videos covering this too, and I did my own CV and my own cover letter, same as I explain in my videos. And I know a lot of people from this channel who got jobs following the same CV format and same cover letter. Once you have a good CV and cover letter, then becomes relevant to your clinical experience. I know people who got jobs with almost no clinical experience with only AMC one and being offshore. So lucky, lucky, but yes, it exists. And I know people who also had good clinical experience, like 4 or 5 years, and got jobs with only AMC one. And then working rights. Some people are already in Australia, so of course they are preferred. But if someone with working rights is presenting a bad CV and someone with no working rights is presenting a better CV, the person with no working rights will get the job, and the hospital will sponsor them for a visa. So sponsoring for a visa, it's not an issue for public hospitals. Maybe some private hospital may have an issue with it, but in general, hospitals are happy to sponsor doctors for a working visa. So the answer is not very clear. It just it's very random, to be honest. Like I applied for a job with AMC one, AMC two, and I was already working in Australia and I have not got shortlisted for that job. And I know someone who applied for the same job and they had only AMC one and they got shortlisted. So am I going to blame saturation? Not really. It's more, other factors like your clinical experience, the day that the recruiter was looking at the CVs, maybe your CV has not been looked up to. So it's just a lot of factors. So don't get demotivated. The only good thing is you have to keep applying, applying and applying, and that's the way. There is no other way to get a job without applying. So the more you apply, the more chances of getting a job. Now the other question, and the very intimidating question, is, will Australia become saturated? I think probably yes. So now in the UK, I think they are trying to give priority to training only for local graduates. So all of the IMGs there who did not graduate from the UK will not get prioritized for training and may not get a chance for training. So all these IMGs will be moving to Australia. The other thing is, every year, if you go to the AMC website, more and more doctors are sending AMC exams. So, for example, this is from 2024, and 23% increase of the people who started the AMC MCQ exam. So, just this year in 2025, the previous year, 7,821 IMGs sat the AMC one. That means 7,000 IMGs are applying for jobs I don't think there are 7,000 positions out there, right? So, and the thing is, 2,000 of those are already in Australia. So most of them may have working rights with a spouse visa, with a working holiday visa, and some of them will have student visa. And then you have international students, doctors as well applying, and these are the countries. And then even in AMC clinical, given the saturation is increasing a little bit more, and the competitiveness is also increasing a little bit more people are sitting the AMC clinical exam, so 8% more on the previous year. So that's something to keep in mind, that saturation increases with time. So likely and probably Australia there will be a point where jobs will be much, much harder to get. I think we are now in a middle ground situation where you can still get a job, even if you are overseas. But I think at some point it will not be possible, maybe. So what are the best options for IMG? So I see a lot of IMGs confused. Should I do the PLAB exam? Should I do the USMLE? Should I go to Germany? Should I do the AMC? Should I do the Arab country exams? Once you are on IMG, you have to really, really have in mind that there is no 100% guarantee anywhere. Even myself, now that I'm in basic physician training, but there is no 100% guarantee that I will get into advanced training of the specialty that I want, okay? Because I will always be competing with local graduates, and always local graduates will have priority, which is understandable. They are from this country, they will live lifelong here, and they have priority. They have much better communication skills, and unless you are a brilliant, outstanding IMG, maybe, but it's still never 100% guarantee. So that's something that you always have to keep in mind. And even when I started my journey, my plan B was always I will do my training in Spain, because if I don't get here, I'm not going to get stuck and I'm not going to waste my time. So it's true that there is no 100% guarantee, but it's also true that nothing is impossible. Like, at the end, the exams, I could pass them in my first attempt, I could find a job, and now I'm started in training. So nothing is impossible. But always is good to have a plan B. And for people who have not started any journey yet, you can choose any journey you want. Maybe PLAB now is a bit dead at the moment and won't be the best one to go, but you can choose UCMLE, you can choose AMC, you can learn German. But always consider that it may not work. And always consider doing training in your home country. Getting training overseas is hard, even for the local. So imagine being an IMG is even harder. So you can be a specialist in your home country and you will have at least a salary and an income and be in a safest position than just being unemployed, trying the exams, getting money in observerships and all the things and never getting there. So considering training home country, I think it's a very practical and a very realistic thing to consider now, because also you never know what happens with visa. Like now, the USA is also having some ban on many countries for their visas. You never know if that will extend to Australia at some point. You never know if your physical health will be fine for the next 3, 4 years, and you may have to stay in your own country, or you don't know if you will lose someone who is dear to you in your home country. So things can change a lot in life. So I think you have to, I'm not discouraging anyone. You want to go for Australia, it's a great career, it's a great country to live, go for Australia. But always keep that in mind, that there is no 100% guarantee, that you should have a plan B, that to consider training in your home country if you have been trying for Australia for 2 years and not worked. And then once you start your training in your home country, it will give you experience. You will grow as a doctor, you will have a better CV, and then you can always come later as a specialist. When I was working, I worked in cardiology, but I worked as well with the team of cardiothoracic. So the cardiothoracic consultants, the surgeons, were all of them from India. And they did not come with the AMC pathway, they came with the specialist pathway, and it got recognized. I know they will tell you that surgical pathway is very hard to recognize, but if you have been working in India for 10, 15 years as a surgeon, you can come with a specialist pathway. So training in your home country, it's an opportunity to you come later as a specialist, be it to Australia, be it to I guess the UAE as well have a lot of specialists from their home countries. So don't get stuck as a doctor. Keep growing, keep gaining experience. Even if you get in training in your home country, it doesn't mean you have to finish it, because if you get in training and then you build a good experience and then you get a job in Australia, so just come to Australia, it's okay. But at least you are having that plan B, which is a safe plan B, rather than just floating and not have anything in your hands. So I hope this video gave a bit more understanding how is the situation in Australia and how the situation will look in the future. And I hope this part was not very depressing. This is the reality. I'm a very practical person. Even at the moment, I feel like if I don't get in my desired specialty, I will always consider going back to Spain and doing my specialty training there. But let's see how things go. And, Life changes a lot, so anything can happen in life, especially with a lot of political instability at the moment. So, wish you all the best, and we'll be uploading more videos soon. Goodbye.